Hi, Dr. Joe here to talk about the upcoming flu epidemic. There's always one, and they're always heavy portent of bad problems. For example, the one that I've been talking about for about 2 years now is an H7N9 strain. That has not been seen before this strain began to hit people in China. And they had 150 people have a big bad problem with the flu just for a while, but the deaths only got to 43. And so they said it's not a big deal. Not a big deal. Well, there are other points they are talking about now. The immunogenesis of this whole thing, in other words, how can you prepare yourself for getting this, is a good flu shot. And what they're trying to do is to come up with a new vaccine where you don't get sick from the vaccine, as many people have in the past, but you're in a place where actually you can make something really special out of this. And it's as simple as knowing how to chop it into 4 parts. A good friend of mine approached the CDC about this some years ago. Unfortunately, he had an accident, fell from his back porch, which was 2 stories high, and killed himself. But he was very concerned and even spent 3 days with the CDC putting everything together about how to break it into 4 parts, cut it up in little pieces. So each part is immunogenic. Each part will give you some protection against the flu, but none of them has enough bigness, quality, anything that a virus would like to have to hurt you. That would be a really good epidemic closer. I think we've gone very far in this. Everything that I've read in the journal Science, which I'm reading right now, is that, yeah, we're getting there. We're going to have something that's probably going to be better. But we don't know it yet. So what I will be talking about is a variety of other ways to handle these things personally. All the medications that we talked about 3 or 4 years ago, everybody's resistant to them now. So we don't have much to talk about. We do have other things that will come out. The immunogenic way we're going to use vitamin D in preparation is going to be a very major thing. And there'll be other things as well. So all is not bad necessarily, but we can't stop thinking about it. This is really a big deal. Because if you get flu this year and you aren't prepared and you don't know what you're going to do, I don't know what you're going to do very well. It might be your time.